Well, what happens when one of the only two facilities producing a crucial drug for PET scans runs out of the materials needed to make it? This is not a hypothetical question. It has been a reality for over a month for cancer patients who relied on PET scans for diagnosis and treatment planning were left in a limbo due to a critical shortage. The result? Delayed care, uncertainty, and growing fear for those whose lives depend on timely medical decisions. Now, after weeks of disruption, production has finally resumed, but the crisis raises bigger questions about the fragility of the country's healthcare system. Liz Njeru Mutinda with that story.
For the last 30 days, Grace Nduta, a stage 4 breast cancer patient, has battled an irritating cough. So bad was it that doctors recommended a PET scan to assess whether her treatment needed adjustment. But when she tried to book the scan, she was met with an unexpected obstacle.
When I went there, they told me they don't have medicine, radio isotope. Yes. So when are they coming? We are not aware. Until further notice. In fact, that was the word. Until further notice. So what will I do? I told the doctor there are no medicine there in KU. She told me, no, go try Nairobi West. I went to Nairobi West. There are no medicine. There is no radioisotope. Hey, what do I do? Go to Ruai Family. I went to Ruai Family.
Grace could have travelled across the country if needed, but PET scan services are limited to just a few facilities, all within the Nairobi metropolitan region. Their proximity to the production facility isn't by chance, it's a necessity. The drug used in these scans decays rapidly, making long-distance transport unfeasible.
So PET scan is an imaging technology that is used to basically is more oriented towards imaging cancer patient. And the goal is it has an advantage of being able to see the disease, even the smallest of the lesions. So it has an advantage compared to other imaging technologies that we have like CT and MRI. So the fact that we want to see cancer as early as possible, then we'll opt to go.
On Tuesday, Ruai Family Hospital sent Grace a text message confirming the delay while attributing it to a nationwide radioisotopes shortage.
For a PET scan to be done, you need to have the medicine that we call radioisotope, or it's also called radiopharmaceutical or radiotracer. Now, the production is done centrally in this country, and we have one center, KU, Kenyatta University Teaching and Referral Hospital. They are the ones that does production for radiopharmaceuticals. So most of the centers within the metropolitan will depend on them. Now, the production itself it involves a lot of things that there are so many consumables that are needed that need to be imported. They are not produced in our country, but we import from other part of the world. Now, sometimes this kind of interruption in the process of procurement and bringing in these consumables, this is what causes delay in the course of production. And now, if you don't have the consumables, you cannot produce the radioisotopes. So if you don't have radioisotopes, you cannot proceed with scanning, or you cannot go ahead and do a PET scan.
Nairobi West Hospital had also paused PET scans, citing an acute shortage from their supplier, Kenyatta University Teaching, Referral and Research Hospital. However, they've now resumed services after receiving a fresh supply from KUTRRH today. With cancer now the third leading cause of death in Kenya after infectious and cardiovascular diseases, the demand for these scans is high.
When you fail to get a PET scan, you're almost as good as trying to gamble with treatment, because all you can do is to be hopeful that whatever will be done to you will be sufficient to eliminate the cancer.
While the fresh supply has restored operations, the questions remains. What happens the next time a shortage hits? Lilis Njeru Mutinda, NTV.